info. Go ahead, ma'am.
Good afternoon, everyone. Very warm welcome to all of you. My name is Dr. Sarabjeet, and I'm working as a consultant doctor at Oasis Fertility. So today in this afternoon, we are going to discuss about PCO, which is for some people know it as PCOS, for some people know it as PCOD. So this is one of the commonest condition which today's youth is I think suffering from. And this is the commonest condition regarding which almost everyone has many doubts. So my goal in this presentation today will be to give you a brief overview about what is PCOD and what are its effects on the health and how can we go about to treat it and manage it. PCOD, PCOS both basically mean the same thing. PCOD stands for polycystic ovarian disease and the PCOD stands for the syndrome. PCOS term is now these days more favored because it is the common myth is that it leads to just irregular cycles. But actually, PCOS affects you on multiple levels. It is not just irregular cycles it leads to. It has many effects like insulin resistance. It has which leads to many other effects on your body. Regarding that, I will be telling you in detail later today in the presentation. As we know, this is one of the most commonest condition everybody is facing these days. So, what are we are going to discuss today? First, I will concentrate on what are the symptoms people usually face. Like, what do you are facing that indicates that you need to go to a doctor, get yourself screened, and diagnosed about it. Then, next thing which will be coming upon is how do we diagnose whether we have this condition or not. And the final thing, how to manage it up. So basically, what are the main symptoms which you will have, which gives you an idea that you might be suffering from PCOS? The commonest is it starts from basically adolescent age in some people. In some people, it starts expressing late. So the commonest which you feel is irregular cycles. If you have irregular cycles, then you should go and visit your gynecologist. So what do we mean basically by irregular cycles? Irregular cycles are very common in the first 1 year when you attain your menarche. Menarche basically means start of menses. So they are very common in the first 1 year post starting of your periods. But if you are having irregular cycles after that 1 year, you should go and visit your doctor. So what do you mean by irregular cycles? Any cycle which is less than 21 days or more than 35 to 45 days. Any lady who's gotten her periods 1 year post period to less than 3 years post attainment of period, any cycle which is more than 45 days, you need to consider. And if you have started your periods and already 3 years have passed since that, any cycle more than 35 days, you should go and visit your doctor. So that will be the first symptom that we see irregular cycles. Coming down to the next factor is hyperandrogenic symptoms. Basically, what that means, it means having slightly excessive of male hormones in your body, which will express as acne or hirsutism. Hirsutism basically means excessive hair growth. Now, this hair growth can be seen, along the sides of your cheeks, sometimes at the arms, legs, lower back, chest, stomach. So if you feel that the hair growth in your body is excessive, you should again meet a doctor. Next, next which you can see is because of this hyperandrogenism is that some darkening of your skins close to the neck, underarm, between thighs. That is known as acanthosis nigrans. That is also something which is very commonly seen. So if you are having any kind of these symptoms, you should go and visit your doctor, and these might be the signs that you need evaluation. Okay. Another something which is very commonly seen is that the girls who are suffering from PCO are slightly obese. Basically, they're slightly healthy. But it is not necessary that if you are obese, you will only have PCO. PCO can be there even in very lean, thin women also. Okay. Next, when you go to your doctor next, how will she come to know whether you have PCOD or not? So usually, first thing they will check you is for your clinical symptoms. Like what kind of a signs or complaints you have come with it. Like, you have any cycle irregularity or what all symptoms you have. The next thing, they might advise you for an ultrasound. Ultrasound, which shows some kind of a changes in the ovary, which suggests that you might be suffering from PCOD. Now, in some people, sometimes at adolescent age, which you've just gotten your periods, maybe the ultrasound might not be very correctly able to diagnose it, so it is usually avoided also sometimes. If you've just attained your periods and hardly 1 or 2 years goes that. And the third factor will be, which helps in judging, is the clinical evidence of hyperandrogenism, which I told you in the form of hirsutism or the acanthosis, or some blood tests. Blood tests to check the level of androgens. If they're high, are also indicative of PCOD. The commonest criteria for diagnosing is Rotterdam's criteria, which we follow, in which 2 or 3 things should be there: polycystic pattern of the ovaries, irregular cycles, or your hyperandrogenism, whether clinical symptoms or whether the blood test which indicates it. So this is the way maybe your doctor will start evaluating you up about it. See, we have seen there are multiple factors right now leading to PCO. You might like to know the reason why we are suffering from it and all like that. There are some clustering of cases in the families also, which suggests maybe there is a familial link, but at the same time, it is more of a lifestyle disease. You're more of a lifestyle disease, like what kind of a pattern of your whether you are obese, your stressful life, environmental toxins which we are routinely exposed to, which are practically unavoidable. At the same time, lack of exercise, sedentary lifestyle, food habits, eating junk food and all that, processed foods. So this is another factors which can lead to it. And it is a multifactorial reasons. It is not one pinpoint factor which we can pin out and say that this is the reason you're having it. Maybe just correct it and all. So that doesn't exist in PCO. So now, what are the effects of PCO? Regarding what the effects of PCO in your body. First, it will lead to irregular cycles, which is troublesome for everyone. The second thing, if you get late period, sometimes, if you have skipped your period and you're getting a period after 30, 45, 45 days, sometimes the bleeding gets to be heavy. That is also one of the reasons you need to visit your doctor, and they will further help you in that. So that is one of these aspects. The second thing is the hyperandrogenism which exists, which we basically, act on multiple levels, and the main pathology which is being seen is anovulation. Anovulation, basically, the egg does not get released on time, or it doesn't release at all. Because of this anovulation, indirectly expresses in your form of irregular cycles and leads to infertility or decrease subfertility, by the think correct word to use, that it decreases the chance of pregnancy because the ovulatory ovulation becomes erratic. So that it leads. That's the reason it is one of the most commonest reasons for fertility issues. So that is one thing which expresses. Along with that, there is something, the major pathology or the major something, major factor behind it is hyperinsulinemia, which exists in everyone. This hyperinsulinemia basically means what? That there is an insulin resistance. This insulin resistance will indirectly lead to hyperandrogenism. And this is the basic pathology which is responsible for all the issues you face in PCOS. This hyperinsulinemia will increase your chances of obesity. This obesity will, especially if it is abdominal obesity, that is, if you have more fat around your tummy area, it will lead to further increase in insulin resistance. So it becomes a vicious cycle, and you get trapped in that. So basically, so that is the reason one of the ways they suggest is to weight loss to some extent might decrease your PCO effects. This hyperinsulin insulin resistance, which is present in your body, at the later stage can lead to increased incidence of diabetes also. So, lifestyle management in that case becomes a key in PCOD for the same reason. And how does PCO affect your fertility? That is the commonest question we face, that how does it lead to? First, the way I told you, it leads to decreased ovulation, basically affects your egg release, ovulation, so that's the reason it leads to fertility issue. At the same time, it can affect your oocyte quality also, the egg quality also, that also contributes to infertility. So how do we go about treating it up? That's the commonest thing we want to know about, how to treat it up. So the treatment basically consists of, first of all, a lifestyle change. There is no doubt about it. You have to change your lifestyle. Now, what do we mean by basically a lifestyle change? What I mean by that is, first of all, you have to start exercising. Start exercising and maintain a health. You need to create a regular exercise. Exercise doesn't mean you have to really go to gym. You can start a brisk walk also every day. So basically, exercise is the key. And weight loss in the people who are obese. So obesity, as such, the way the way I told you, it increases your PCO. It is said that you lose 5 to 10% of your PCO, and it can correct many of the factors which are responsible, for PCOD, to some extent correct the disease in itself. People who have lost around 10% body weight can also, resume the ovulation, and the cycle irregularity can get corrected. So the next question you will ask me is that, fine, if a person is obese, it can lose weight, the person can lose weight. But what about the people who are already thin and they have PCO? So weight loss is not suggested for the people who are basically on the thinner side and have PCO. For them, it is suggested that you maintain that weight and avoid a tendency to gain weight, because in that case, your PCO will increase if you gain weight also. And exercises is recommended in both the groups, whether you are obese or whether you are thin. Now, what extra elements are included in the lifestyle management? First, I told you weight loss in case of obese people, avoiding weight gain in lean people, and doing an exercise daily. The next thing which comes is eating healthy. That means taking some nutrients, taking some fruits, nuts, and basically avoiding all kind of processed junk food and excessive, carb-related diets, sweets, and all those things. Basically, eating healthy is one of the ways you have to include in your lifestyle. That's it. So this will include your lifestyle changes. That is one to say. Now the treatment is further divided to basically two. If you are one of the young girls who come to us, or if you are on the a lady who's just about to get married or has just gotten married but does not want to get pregnant at present. That will be one aspect. And the other people who are basically facing fertility issues and have come because they want to try for pregnancy. If you're a young adolescent, or a young girl who's not yet married and basically has come with irregular cycles, and in that case, if you're obese, they will advise you weight loss, or at the same time, they put you on some medications to correct your cycle irregularity, so that you can have regular cycles. See, the cycle, the medications which are given basically to you to regularize your cycle will have a temporary effect by the time you're taking it, or maybe 2 to 3 months later to that. Basically, this is a period which is given to you that you correct your lifestyle, you correct, you lose some weight, so the disease, the process which is there gets corrected, and the cycles resume on their own. So this is the way you manage if you're not planning the pregnancy. Another symptoms like if you have acne, they might put you for some pills again to correct the hormonal imbalance. And for the excessive hair growth, if you have in your body, they might suggest you basic other things also. Uh, Regarding hair removal ways, or some medications, because as soon as your hormonal imbalance of the piece is corrected with the drugs, to some extent yes, it does comes down, but you might need in other ways also. Now, if you're one of those women who are married and want to get pregnant in the future, but at present are not planning pregnancy, in that case, the only thing I will suggest to you is that in case you are obese again, lose weight, because if your periods get regular by losing weight, then you might not come at a stage that you need treatment with fertility treatments. If the cycles become regular, if the cycles are not regular, then yes, you will need uh, treatment to might conceive. And you can definitely contact us again. We can guide you some kind of measures what you can do to decrease your PCO element to make your cycles regular. By the time you reach to a stage when you are ready mentally for pregnancy. The last aspect is if you're facing fertility issues and you have come and now you want to conceive and you have PCO. The basic mechanism for not conceiving usually what we see is irregular cycles. So in that case, now we have many drugs available. We give you basically drugs to cause drugs to induce ovulation. Then you monitor it up and by follicular scans, and then we let you know which are the days you try. That's the most basic form of treatment which is followed and which is advised as a first line of treatment if any other all the rest of the tests are normal and there is not many other issues which your doctor has diagnosed. Definitely, if you come to a fertility center and you're planning a pregnancy, the basic evaluation will include the ultrasound scan. Then next to see for your ovary size and basic whether you have PCOS or not. Another thing which will include is basic blood tests, which will help us to see whether you have increased nitrogen levels or not. And the basic treatment which we start us with is OITI cycles, which are known as basically we give you medications for information, do a serial scans, and then guide you further when to try for pregnancy. And if you have, as a couple, if you only have an issue and no other issues or anything like that, then you follow a simple way, of guiding you through these medications. And then if you don't respond, even maybe you step it to the next level and then to the uh, even go ahead with like an IUI, and then maybe you can even proceed for an IVF also later on if you don't end up conceiving in the basic treatments. Now, if you are planning a pregnancy and if you are obese and if you started your treatment already, and even if the egg is now getting released properly, you've been trying some things, but still we advise weight loss. See, weight loss is the key for in the PCO management because weight loss will increase your response to the drugs which we are giving you. So, and at the same time, correct the hormonal imbalance also. Okay. So, again, the lifestyle management and the weight loss has to go hand in hand, whether you are taking treatments or you are not taking treatments. Another aspect is the whatever best we can do to with the lifestyle factors and the obesity. If we try to counteract it, if the hormonal imbalance or if this is to some correction happens, it will affect it will help in improving the egg quality also, which is another issue we face a lot in PCO when we are trying when we are giving fertility treatments for couple. So, and the last thing some people ask is, so we have drugs and we have, if supposedly, you've come with us and we've given you tablets and then you've not responded and somehow the ovulation has not occurred, that's seen. So, there is not much need to worry or anything like that. These days, there are many injections also available, which your doctor will only prescribe you and they're given a specific pattern that can help us to resume ovulation. But at the same time, when we're going through this treatment, there is a small chance of having excess follicles and having a twin pregnancy like that also. So meet your doctor, and then he will guide you further for that. How we go about and how to avoid having that. And last thing, which is a treatment modality which is available, is laparoscopic ovarian drilling also. But with the recent drugs and the recent injections and so many, the drugs and the medications have now come out that the indications for that have become very rare and it is not usually now advised. The indications are very restricted for a very specific population, and most of the couples can go without that also. So this is the way basically a PCO is managed. I'm hoping that whatever I've told you today, whatever I've guided you today, we would have had help you in removing some of the myths, clearing some of your doubts. And if you have any questions further, you can just reach out to me, and I'll try my best to clarify them further for you. But in the end, just I want to ask us, it is a lifestyle disease. Exercise, lifestyle changes, and decreasing weight in case of obese If you have obesity, is one of the key important parameters which are required. And if you're visiting any fertility center, the doctors will take care of the treatment, and they will through all those medications and to help you pregnant. At the same time, concentrate on the lifestyle factors also. They are needed even if you are on treatment. Any questions, please? Irregular periods, yes, is one of the sign of a PCO, but that is not the only factor. If you just have irregular periods, you will not be diagnosed as PCO. You might have another reasons also. So PCO usually needs, by Rotterdam's criteria, 2 out of 3 factors to be diagnosed. If you just have irregular cycles, that does not mean that you have PCO. You need to have either PCO, polycystic ovaries pattern on the ultrasound, or your ovarian volume is more, or another factor, or you need to have symptoms of hyperandrogenism, either in the form of clinical symptoms or the blood test show the evidence of it. So if you have 2 out of 3, that is irregular cycles, polycystic ovarian pattern, or hyperandrogenism, only then will be diagnosed to be having PCOS. There are many other factors which can lead to irregular cycles also apart from PCO. So if you just have irregular cycles, what your doctor will do is just do some blood tests and evaluate other reasons also, if there is nothing else found in the scan. PCO cure naturally. See, the way I've been stressing on my entire presentation again, that PCO is basically to some extent a lifestyle disease. Whether PCO can be cured 100% or not, I'm not sure about that, but you can definitely decrease it. Like if you are an obese individual, if you have lost your weight, and then the cycles resume, the symptoms of your cycles have resumed, to some extent, it can come down. But again, if you increase your weight in the future, then it can definitely come back again also. So, for the natural cure, which you are asking, is the only 2 things that in your hand, that is your exercising, eating healthy, avoiding junk, and losing weight in case you are obese. And in lean thin people, just maintaining the healthy lifestyle and exercising. And rest, after you've done this, after you've achieved this, if you still have any symptoms, like if your persisting irregular cycles are there, or if you still have fertility issues, then your doctor will take care of that. Thank you so much. And anything else anybody wants to ask? Okay. Thank you.